Good morning and welcome back to Open Med School. In the last sessions, we have discussed about the method of history taking and the pathophysiology of basic cardiac symptoms. Today, I'll be discussing the physical examination of heart or cardiovascular system. Physical examination, usually we do it as a general examination followed by that system examination, that is cardiovascular system. So first we will go into the general examination. The basic thing is that try to secure if possible well lighted and quiet room. Perform examination from the right side of the patient. Look at the vital signs. As far as possible, you should record the vital signs yourself, even if it is given in the. So vital signs are vital. You should try to, even if it is recorded, try to record it yourself. Hope this point is well taken. So there should be a format in writing, but the method in which you do may be a little different. So here I will be discussing. First you do a general observation, followed by vital signs, examination of the hands, eyes and face, neck, skin, legs, and finally sacral area. That is what I am going to discuss today. So this is the format I would like to follow you. Whatever format you should try to follow religiously, so that it will later become a habit. We can either do the general examination first or vital signs followed by general examination. Both are acceptable. So most patients expect that you will examine the patient by holding the hands. So again, this is a good approach. Examine the hands. You give a shake hand to the patient. The hand may be sweaty, warm. Sweaty and warm hands suggest hyperthyroidism. Cold and sweaty, it is likely to be due to anxiety or sometimes in patients with the heart failure. Okay, so what are the other things to be examined in the hands? One of the very important thing is looking for clubbing. Clubbing is a bulbous enlargement of the terminal phalanx. It's a bulbous. Sometimes clubbing and cyanosis can occur together. Cardiac conditions producing clubbing are most important thing about the congenital cyanotic heart diseases. Second is the congenital heart disease becoming cyanotic. That is called Eisenmenger syndrome. You will study later. Eisenmenger. Third important condition where you get a clubbing is infective endocarditis. Sometimes in left atrial myxoma you can get. So there is a clubbing. Clubbing and cyanosis together occur in congenital cyanotic heart disease and Eisenmenger syndrome. That should be also be kept in mind. So what is clubbing? Clubbing is the bulbous enlargement of the terminal phalanx. So terminal phalanx becomes bulbous. There are stages. First degree is fluctuation, second degree obliteration, third degree parent peak, and fourth is development of pulmonary osteoarthropathy. That will be discussed detail in a session on clubbing. You should examine the patient tangentially, look like this, then look for the Shamrose window test and see whether there is a diamond shaped area is there. Examine both hands and also the toes also, because there is something called differential cyanosis and differential clubbing can occur. So this is the Shamrose window test. You can see a diamond shaped area here. Here that area is that the Dobie bond angle is lost. It's around 180. The angle is lost. So this is a must you should examine. So read about clubbing, the cause of clubbing in various other conditions also. Another important condition that you should look in the nail is the splinter hemorrhage. Splinter hemorrhage is longitudinal bleeding spots. You can see this here. This is a sign of infective endocarditis. Very rarely you can get in vasculitis like SLE, Cyanosis. They are all very rare conditions. So remember to look for infective endocarditis. So nails, then pallor can be there, leukonychia can be there. So all these things will come later on. Another important finding you should look for is what is called Osler's notes. Osler's notes can be remembered by it is 3 piece, pea-sized. It is on the pulp of finger and it is painful. These are the features of Osler's notes. So here palpate the finger and see whether there is a okay. Genuine lesions are similar lesions on the palm which are not painful. That is the difference between Osler's notes and genuine lesions. Then again you look for any abnormalities in the hands, any deformities, wasting, all other things should be looked for. Now it is time to examine the pulse. Examine the radial pulse. Again the methodology and other abnormalities will be discussed in detail in session 1. Again remember, it is a good habit to examine both pulses together in the beginning. Count at least for 1 minute as a beginner, because patients may be having some arrhythmias that can be detected only by counting for 1 full minute. And especially atrial fibrillation, when it is controlled, it may appear as a regular rhythm. So that is why you should carefully examine. All the characters of pulse is examined in the brachial or carotid pulse, except the collapsing pulse, which is examined in the radial pulse. So details of pulse examination will be discussed in another session. Next is counting the respiratory rate. Respiratory rate is counted pretending that you are counting the pulse rate. So that is the method of examining. And now it is time to take the blood pressure also. So take the vitals including SpO2, pulse, PP, respiratory rate, temperature and SpO2. These are the vitals. Some people include the glucose also, but again at present these are at your level. Now look at the face. Some of the diseases can be diagnosed by looking at the face. For example, somebody with hypothyroidism, or somebody with Down syndrome, Elfin facies, in cyanosis. So there are certain facies we should try to identify. Then abnormalities in the face, it is a xanthoma. So yellowish plaques like this, which is suggestive of dyslipidemia, but this can be seen in persons without dyslipidemia also. That should also be kept in mind. Now it is time to examine the eyes. You make the eye with both hands, move like this, and then the both upper ask the patient to look down and look for the major abnormality that you are interested in. One is pallor. So look for the conjunctiva for pallor, cyanosis, congestion. That is a patient with polycythemia can have a congested eyes. Always also identify jaundice. When you are looking for jaundice, preferably in daylight. Artificial light may interfere with the identification. Pallor can be diagnosed not only by looking at the eyes but also by looking at the palms. Suppose the palmar crease is less colored than your other part. That means hemoglobin is less than or equal to 7 grams. The nails will also appear pale, skin also can be pale, mouth also will be pale. So these are other areas where we look for the pallor. So pallor, so examination eye should be an integral part of the examination. Now look at the mouth. Mainly we are looking for cyanosis. If the tongue is cyanosed, that is a mucosa is cyanosed, it is a central cyanosis. So in order to differentiate central versus peripheral cyanosis, you can look at this is a helpful thing. Hope it is. That is, we are mainly concerned by looking at the tongue for identifying cyanosis. Now look at the neck. In the neck we are interested in one, the neck, the jugular veins. Second is the carotid, if not examined early, the thyroid and trachea. Each one will be discussed in detail at a later time. So things that will be you are interested in looking, examining are one is the JVP, the carotid pulsation, the thyroid gland and the trachea. It is internal jugular vein which is usually looked for, but sometimes external jugular vein can also be utilized. So the examination of JVP is very important. It is measured from the angle of the vertical distance. Suppose here is a JVP. This is the distance that you have to measure. It will be discussed in another session. And this is the location of carotid artery. Palpation of carotid artery will also be discussed in the along with the examination of pulse. The only point to be remembered is in elderly when you are examining, auscultate the carotid before palpating. Never palpate both carotids together. Never palpate in the standing position. These are some of the points you should remember. And many of the characters of the pulse is described in the by examination of the carotid. Hope these points are clear to you, and you should look at the thyroid, because thyroid, hypothyroidism and hyperthyroidism both can lead on to cardiac problems. Now examine the skin, whether there is any bleeding spots, any pigmentation, anything, and then finally go to the lower limbs. The lower limb, the most important thing other than what you have looked for in the upper limbs is looking for edema. In cardiac failure, you get what is called a dependent edema. Dependent, for a patient who is walking, the lower limbs are the dependent. Somebody is bedridden, it is the sacral region. So the cardiac disease dependent edema is bilateral, it is symmetrical, it is pitting, and it is non-tender. This should be, you should remember, that is, it is bilateral, symmetrical, pitting, non-tender. So any patient, when you come with a pedal edema, always remember to look at the JVP also. If the JVP is not there, pedal edema, it is due to disease like liver disease, hyperproteinemia or some other causes. Hope this point is clear. And again, a patient who is bedridden, it is the sacral edema should look for. Remember this. And in the next session, we will be discussing how to examine the cardiovascular system. We have done about the, we have discussed so far is the general examination related to cardiovascular system. Thank you.